Do you have e-Asthma? Let's find out. The name of this podcast is Asthmaniac. I'm Dr. Tim Reichon, and I designed this podcast to give my asthma patients essential information about asthma. My goal is to put asthma patients in control of their breathing, preventing asthma attacks, and pursuing active, rested, and fulfilled lives with confidence. E-Asthma is a category of severe asthma. Patients with e-Asthma have difficulty getting asthma control with usual treatments. It responds well to a new type of injected medicine, and in patients with e-Asthma, this new medicine can decrease their asthma attacks and allow them to use less oral steroid. They experience fewer asthma attacks and have a much better quality of life. Let's talk more about this. As I said, e-Asthma is a type of severe asthma that responds well to a new kind of controller medicine that you inject under your skin, usually monthly. Severe asthma means you've been on a high-dose inhaled corticosteroid and long-acting bronchodilator or theophylline for the past year, and you've been treated with steroids like prednisone by mouth for more than half of the past year. There are well-defined numbers for what qualifies as high-dose inhaled corticosteroid. This new type of injectable asthma medication has been shown to dramatically reduce the number of asthma attacks you have and reduces how much oral steroid like prednisone and inhaled corticosteroid you need to stay controlled. How do we know if your asthma is the type that will respond to this medicine? You would be likely to get a good response to this new medicine if your eosinophils are elevated in your bloodstream and your allergy testing shows that you are triggered by seasonal allergens. So let's review. If you have been on high-dose inhaled corticosteroids, oral steroid for more than half of the year, and you have skin allergy tests that show a problem, then I would recommend having your blood drawn to measure your eosinophil count. If your eosinophil count is elevated, you would be a good candidate to try this new type of medicine. What medications would be considered? I have a list of them on asthmaniac.com for you to review. These medications are quite new, and it will take some time for general practitioners to become educated about prescribing them, but they are available right now, and if you are suffering from severe asthma, they could be a really good solution for getting your severe asthma under control. Complete the subscription form on the right if you'd like to get an email when I post a new podcast and blog entry. And remember our hashtag, AsthmaCareNow, and keep breathing easy. Asthmaniac is all online, all about asthma. Your go-to for asthma doctor visits, asthma medication refills, personalized asthma action plans, and asthma education. Asthmaniac.com.